If you are one of the millions of people suffering from some form of anxiety disorder, then you are most certainly familiar with some of the current anti-anxiety medications. The term anti-anxiety medications is pretty self-explanatory. Their purpose is simply to reduce anxiety in patients. However, the exact method of doing this varies greatly from one medication to the next, but most work by affecting the neurotransmitters in the brain, such as serotonin. Since anxiety is a very challenging issue, it is best to see a medical practitioner that specializes in various anxiety disorders. With so many different anti-anxiety medications on the market, it would be helpful to work with a doctor who has experience working with some of them. The thing to remember is that anti-anxiety medications are not meant to be a long-term solution and can in fact become quite addictive if taken for long periods of time. There are also many side effects associated with various anti-anxiety medications, which is even more reason to limit the amount that you take and also the duration that you continue the treatments. There are many different types of anti-anxiety medications available on the market, from the traditional benzodiazepines to newer beta blockers and antidepressants. These drugs have varying effectiveness from one patient to the next, so your doctor may have you try several different ones before finding one that works well for your situation. Once you do find one that is effective, you must still remember that it cannot be considered a cure. While it may provide some temporary relief, it will not cure the anxiety disorder itself, which is the root cause of the problem. In addition, the treatments can be very addictive, both physically and mentally, which can be a very big problem in itself. Withdrawing from these drugs can actually cause anxiety attacks, so you must be careful to come off of them slowly. Tranquilizers like lorazepam and diazepam slow down the central nervous system, which has a calming and relaxing effect on the patient. They generally work very quickly, making them ideal for trying to stop a panic attack. The downside is that they have some negative side effects associated with slowing down brain activity. Some of these include clumsiness, drowsiness, dizziness, depressions, confusion, memory loss and impaired judgment, among others. As expected, the higher the dose, the more severe the side effects are. Because of this, it is recommended that patients take the lowest dosage possible. In addition, benzodiazepines break down very slowly in your body, meaning the levels of the drugs can actually rise over time, leading to sedation and even drunkenness. Since these drugs work to block out feelings, they have been proven to block out happy feelings as well, which can lead to depression. Since various forms of depression can come along with anxiety disorders, this can lead to an unsafe situation. It is very important to monitor your feelings and side effects closely when taking any drug, especially anti-anxiety medications.